Those who don't know you, what is your name?
Michael Schmidling,
What is your specialty?
Interventional Radiology.
How many years have you been practicing interventional radiology?
Approximately 25 years.
Where did you go for undergrad degree?
Rutgers University.
What medical school did you attend?
I attended a joint degree program between Rutgers University and University of Medicine and Dentistry in New Jersey, now known as Rutgers Medical School.
Did you take any gap years before going to medical school?
No.
What was your favorite part of medical school?
Gross anatomy.
What specialty did you think you were going to choose when you entered medical school?
Cardiac surgery.
What made you fall in love with vascular interventional radiology?
My wife.
How many years of school did you need after medical school to become an interventional radiologist?
After medical school, I did a 1-year internship, 4 years of general radiology residency, and then a year of fellowship dedicated to interventional radiology.
What would you say is the most unique part of your specialty?
I think the way in which we integrate technology into patient care is fascinating and one of the major reasons that drew me to interventional radiology.
What are the stereotypes about your specialty?
I think one of the stereotypes about my specialty, which has changed over the years, is that we aren't involved in direct patient care, but rather see patients for procedures only. But this has changed quite significantly, where now we're directly involved in patient care, in consultation and follow-up.
How many patients do you see in a day?
Typically between 10 to 20 patients a day.
What is your favorite procedure to do?
My favorite procedure is prostate artery embolization.
How many hours do you work in a day?
Typically 10 to 12.
What time do you normally wake up?
6:30.
What time do you usually leave the Vascular Institute?
6:30, no, I'm kidding. I typically leave work around 6 p.m., 5 to 6 p.m.
What is a unique medical fact that you'll never forget?
In the semicircular canals, there are small otoliths or small rocks that float inside part of your skull to tell you which direction you are standing.
How long does it take you to chart?
Depending upon the complexity of the patient consult or procedure that I'm charting for, typically on the order of a few minutes to 5 to 10 minutes.
What is the most common medical advice you give your patients?
Stop smoking.
What is your favorite medical fact?
Didn't I just answer that? Skip.
Let's talk about you personally. What is your favorite thing to do when you're not working?
My wife and I go on evening walks every night. That's my favorite pastime.
Do your family members ask you random medical questions?
Absolutely.
What is your favorite animal?
Doberman.
What is your favorite color?
Blue.
What is your favorite purchase?
I like going out to eat, so restaurants.
What is your favorite hobby?
Walking.
Do you collect anything?
Old license plates and tools.
If you could have dinner with anyone, past or present, who would it be?
Ronald Reagan.
Coffee, tea, soda, or water?
Coffee, definitely.
What is your favorite lunch to have while working?
Taco Bell?
Pineapple on pizza, yes or no?
No.
What is your favorite meal to eat?
Taco Bell?
What is your dream career?
I'm living my dream career.
How do you relax after a work day?
Walking.
Do you prefer nights in or nights out?
Nights in.
Beach or mountain?
Mountains, definitely.
Walking or running?
Walking, run, definitely. Walking.
Are you an introvert or an extrovert?
I would say an extrovert.
Is that why you chose your specialty?
Part of the reason, yes.
Can you share a fun fact about yourself?
I like Dobermans.
What did you want to be when you were a kid?
Cardiac surgeon.
Is there a different specialty you think you would have done? That kind of answers that question.
Cardiac surgery was a potential, but interventional radiology is way more interesting and varied and more direct interaction with patients.
If you didn't go into medicine, what other careers do you think you would have pursued?
Microbiology.
If you could change one thing about the medical field, what would it be?
More time per patient.
What can a potential medical student do now to prepare for your specialty?
I think if someone were considering going into interventional radiology, I think they should spend some time with an interventional radiologist.
What advice would you give to an aspiring vascular interventional radiologist?
Spend some time with an interventional radiologist.
And lastly, what would you say to your current and future patients?
Stop smoking. Thanks so much for watching. If you have any further questions, you can find more information online at vi-ami.com.